You are following the tragic incident unfolding off our shores involving the sinking of the Spanish fishing vessel. On behalf of the entire province, I extend my sincere condolences to the families impacted by the incident and to thank the dedicated team of people working to find the crew members. Late yesterday, I spoke with Spanish Ambassador, His Excellency Alfredo Martinez, to offer our condolences and support. It was also not lost on me at that time that I was making that call just hours after attending a service to commemorate the 40th anniversary of the sinking of the Ocean Ranger. Like the people of Spain, Newfoundland and Labrador has a historic attachment to the sea. Today, I also want to extend my condolences to those who have lost loved ones to COVID-19. To switch gears now, I think it's fair to say today's COVID-19 briefing reflects the solid situation Newfoundland and Labrador is in when it comes to living with the virus. Your hard work and determination to keep each other safe has paid off. With some of the highest vaccination rates in the country, maybe even the world, we are on the verge of easing restrictions even further. The plan that Dr. Fitzgerald and her team will roll out today will see most things return to normal by the middle of March. This can only be done because of your vigilance, your compliance, your efforts, your determination to continue to care for each other. With almost 280,000 eligible residents of this province now boosted, Dr. Fitzgerald and her team in public health are able to safely, slowly loosen restrictions. Please remember that these decisions, as always, are guided by evidence and science. They are based on expert analysis. We have trusted the guidance of Dr. Fitzgerald and her team at Public Health for more than 2 years, and we can certainly continue to trust them now. My friends, COVID-19 has taken a toll on all of us, but the light at the end of the tunnel is shining brighter every single day. With that, I'll turn things over to Dr. Fitzgerald for today's update and an update and briefing of the new measures in place. Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. I'll start with a brief update. So there are 16 people hospitalized due to COVID-19 severity. There have been 178 new recoveries in our province, leaving 1,696 active cases in the province. Since the update yesterday, we are reporting 179 new confirmed cases of COVID-19. 113 are in Eastern Health, 20 in Central Health, 34 in Western Health, and 12 in Labrador-Grenville Health. 869 tests were completed since yesterday. Sadly, we are also reporting 3 deaths due to COVID-19 today, and we extend our condolences to the loved ones of these individuals. Our laboratory confirmed cases remain stable, and there was a significant reduction in hospitalizations yesterday, and we are also closely monitoring outbreaks in congregate living facilities for seniors, as they are among our most vulnerable. The vast majority of residents in these homes are recovering from COVID infections without hospitalization. This shows that the vaccines are working, and while they cannot prevent all infections, they are helping to reduce transmission, and even more importantly, a different place if we did not have a safe and effective vaccine at this point. Based on our provincial indicators and trends across the country, we appear to have passed the peak of the Omicron wave. The restrictions we had in place were important to reduce hospitalizations to a manageable level while we were in the height of the outbreak, but we are now at a turning point. We have a less severe COVID-19 strain, a high vaccination rate, a growing booster rate, and therapeutic medications to prevent severe COVID-19 illness. The combination of these factors shift the balance of risks and benefits. We have developed a phased plan to move the province out of the pandemic phase with the goal of eliminating restrictions by March 14th. We will ease measures on February 21st and again on February 28th while monitoring our epidemiology and hospitalizations. With continuing favorable epidemiology, we anticipate that by March 14th, capacity limitations, distancing, masking, and proof of vaccination requirements will be removed. Masking will continue to be strongly recommended beyond March 14th. As a first step, effective 12:01 a.m., February 21st, informal gatherings will be limited to 25 people. Faith-based and cultural ceremonies that require proof of vaccination are limited to 75% capacity. Those that do not require proof of vaccination are limited to 50% capacity. There are no changes to other formal gathering limits on the 21st. They will remain at 50% capacity. Public visitations are limited to 50% of room capacity, and wakes that are held outside of a funeral home or place of worship are limited to 25 people. Gyms, fitness facilities, and dance studios can operate at 75% capacity, and restaurants can operate at 75% capacity. Eating or drinking is only permitted while seated, and masks may only be removed when eating or drinking. Amateur sport and recreation can participate in out-of-region competition, playing no more than one team per day. They can play more than one game per day, but only against one single team. Tournaments are not yet permitted, and essentially this change permits activities such as exhibition games and provides greater certainty for teams that may not have clear regional definitions. Retail stores will have no restrictions, and there will be no changes for bars, lounges, cinemas, and performance spaces on the 21st. They will remain at 50% capacity. More information on these changes will be available on our website in the coming days. All border controls and travel restrictions will be removed effective February 28th. At that time, the rapid testing program will be voluntary for any traveler that wishes to avail of the take-home kits. Effective tomorrow, we are making some changes to contact management for children that attend daycare, recognizing that daycare is essential for children and parents. If a child is exposed to COVID-19 in daycare or outside of the home and has no symptoms, they can continue to attend daycare, but should isolate as much as possible outside of daycare for 10 days if unvaccinated. They are not required to have a PCR test or a rapid test. If they were exposed to COVID-19 in their household, they must continue to isolate for 10 days, regardless of whether they have symptoms. Any child that has symptoms but is not a close contact of a case should stay home and use 2 rapid tests taken 72 hours apart as per current guidance. Excuse me. If both are negative, they can return to daycare once their symptoms are improving and they have no fever for 24 hours. If their rapid test is positive, they should treat this as a positive case without the requirement for a PCR test. Daycare staff and children who are fully vaccinated, asymptomatic, non-household contacts can follow modified isolation as outlined in current contact guidance on our website. They can attend daycare during the 5-day modified isolation protocol. In keeping with recommendations from the National Advisory Committee on Immunization, we will be offering a 3rd dose of Pfizer vaccine to children 5 to 11 years of age who are moderately or severely immunocompromised with an interval of 4 to 8 weeks after their 2nd dose. A booster dose for adolescents 12 to 17 years of age who may be at higher risk for severe outcomes from COVID-19 infections will be offered at least 6 months after the completion of their primary series. While this movement forward will be a relief to many, we recognize that it will bring anxiety for others, especially those who are immunocompromised. Please remember that you always have it in your own power to protect yourself. Masking, distancing, hand washing, and avoiding high-risk settings are all important tools you have to stay healthy. Just because restrictions are winding down does not mean that you have to put away your own personal protective measures. Public health must make decisions on a population level by relying on the science and evidence. And as Chief Medical Officer of Health, I have a responsibility to ensure that the restrictions that are imposed are reasonably required. So I'd like to be clear that our decisions are not a response to the protests happening across the country. We have never shied away from making difficult or unpopular decisions based on evidence. We have always said we would go where the science leads us, and that's exactly what we're doing now. We need to start shifting perspective. This is not the end, but the beginning of the end. COVID will be here for a long time, perhaps in seasonal waves, perhaps not. As a society, we must learn to live with the virus and be ready to adapt. We will likely face more waves in the future, and that could mean revisiting public health measures, but that's just a part of living with COVID that we all need to get used to. Humans need social interaction to remain positive, to maintain positive mental health. It's just how we're built. The impacts of isolation are taking a toll, particularly on older individuals. Many adult children have shielded their older parents from the virus with the best of intentions, but there are unintended consequences of extended periods of isolation. So if you have senior parents that want to engage in more activities, it's important to support them in letting them make those decisions for themselves. Provided you have received your booster dose, you can start getting back to your regular activities such as walks, card games, and family dinners. For the last 2 years, the advice we have provided for day-to-day activities has been fairly detailed. That advice is changing. As we transition back to a new normal, individuals will need to make their own judgments and assessments of risks based on their own circumstances. We showed our resilience when COVID entered our lives almost 2 years ago, and we will need to maintain that same resilience now as we begin the transition out of pandemic. This is a big shift for all of us. Not everyone will adjust in the same way at the same time, but we must move forward. So please be kind and patient with one another in the process, and hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now invite some brief comments from Minister Haggie. Dr. Haggie?
Thank you very much, Premier. The challenge of the last 2 years has really been, the only constant has been change. We have had to adapt as different waves have come and gone. And we now find ourselves in a situation where the shift from pandemic to endemic continues. This is down, as Dr. Fitzgerald and the Premier have referenced, to absolutely superb vaccination uptake by each and every one of you, administered by healthcare staff who have persistently gone above and beyond. As we move into an endemic phase, Dr. Fitzgerald has outlined a whole series of changes based on science and in response to science that will help us get there safely over the course of the next 4 weeks or so. We have changed our approach to contact tracing and symptoms in people who are close contacts of someone with COVID is equivalent to COVID. There is no need, no medical need for testing under those circumstances, as Dr. Fitzgerald has been making clear. We have been hearing about requests for exit tests to allow people to go back to certain occupations. But I think my comment to that is these tests will not do what you wish them to do. A PCR test can remain positive for up to 90 days after the infection is been and gone, and a rapid antigen test for 2 weeks. So if employers or organizations are looking to these tests to allow people back, they're not going to do it. The best thing is the guidance Dr. Fitzgerald has provided. It is simple, it is clear to understand, and it is straightforward and safe. It requires no documentation at all, and I would encourage organizations and employers to exercise some flexibility when dealing with their employees under these circumstances. It is time to get back to our new normal, and this is another step along that road. There will be changes, as Dr. Fitzgerald has outlined, and more to come, with the aim of seeing, hopefully, most of these, if not all of them, gone by the 14th of March. So with that, I'll close, Premier, and hand it back to you for the media.
Well, thank you, Minister. We'll now invite questions from the media.
Thank you, Premier. Today we have 4 reporters joining us. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. There will then be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions today are from Ben Cleary with NTV. Please go ahead.
Thank you. And I guess my first question is for Dr. Fitzgerald, and that's restrictions are winding down as we announced 3 more deaths because of COVID. So could you expand on the indicators that we're past our Omicron peak and that it's safe to do this now?
Sure. Thanks, Ben. So basically what we're looking at, certainly number of cases is one of the things that we look at. We look at our hospitalizations, and those are indicating right now that, comparatively, we're on the down slope of that wave. Death as an indicator, the number of people who have died, it does lag behind where the peak would be. So because it's usually about 3 weeks behind. So it's not unusual that we may see more now, even though our numbers are going down. So we have to, but the peak happened before now. So that's basically what we look at to determine that.
Thank you. And I'm not sure who wants to answer this one, but could somebody expand on what's going to happen to the vax pass over the next few weeks as restrictions loosen?
So we're looking to eliminate the vax pass on March 14th, correct?
Yes. Yep.
Yep.
So it'll still be in place. We'll still use it until then.
Yep.
Our next questions are from Peter Cowan with the CBC. Peter, please go ahead.
I want to ask about COVID cases in schools. We've heard concerns from parents who said, for example, there are, in some cases, almost entire classes that seem to be out with COVID. Where do things stand on the plan to be able to have parents report that through an online form so that public health has a better idea of the level of virus within the classrooms? And how concerned are you that some of those numbers, like the COVID testing, may not be accurate because those school cases are being picked up on rapid tests and are not being reported?
Yeah, so I don't have an update on the testing reporting, but I will get that for you. My apologies there. But with regard to a number of cases, so we certainly look at, we know that there are more cases circulating in the community than what than what gets tested and gets reported. And we accept that is the case. And certainly when we look at the number of hospitalizations, we consider how many of those we know about prior to them ending up in hospital. And that gives us an idea just of, if we're seeing twice as many cases in hospital that we didn't know about as we did, then we think there's twice as much circulating in the community. And that gives us a fair estimate of what's happening. But you're right, there's definitely more circulating within the community. But we also have to consider, vaccination status, the fact that we have a mild disease, and that in children, this disease does tend to be milder still. So all of that has to be considered as well when you're looking at schools.
You said one of those things you look at is when people show up in hospital, how many of them are cases that you knew about through testing or not. Can you give us, what is that multiplier? What sort of sense do you have in terms of how many more cases there are actually out there than are showing up in our testing numbers?
So from the latest information that we have, there's probably 2 to 3 times more.
Okay, thanks.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Premier Furey, last week, during last week's COVID briefing, when I asked about mandates such as the Vax Pass and masking, at the time you stated that the province wasn't looking at ending the Vax Pass and those sorts of mandates as of yet. This is quite a big shift in the last week. So can you and Dr. Fitzgerald expand on what has changed over the last week to prompt these changes?
Well, we said that we were contemplating changes to the Vax Pass. The mandates, you've noticed, we haven't changed. They remain in place. So the mandate for people who are working and require double vaccines is still in place. With respect to the Vax Pass, we said we were contemplating, the week before, we were saying contemplating perhaps adding boosters, but always looking at how that instrument is best used. And we feel like at this time, with the compliance around boosters to begin with, that part of the benefit of the Vax Pass in the first place was shifting behaviors, and Newfoundlanders and Labradorians have shown that they've stepped up. They've stepped up time and again to continue to get boosted, and the booster rates continue to be in a positive direction, especially in the most vulnerable who we're looking to protect. We're looking to keep out of hospital and protect our hospital resources. So a month from now, we think that it's reasonable if the epidemiology remains as it is today, or it doesn't show a dramatic shift, that we won't need that tool anymore. It's as simple as that.
And my next question is for Minister Haggie. Minister, does this mean with these restrictions winding down as of the 14th, as long as everything stays on track, does this mean that you won't be renewing the public health emergency declaration? What's the status of that?
Certainly will take advice, as I have done all along, from Dr. Fitzgerald, but the need for something like that on March the 14th might be not apparent.
Our next questions are from Andrew Waterman with The Telegram. Please go ahead.
Good afternoon. I believe this would be for Dr. Fitzgerald, though I could be wrong on that. I've spoken with a mother who has written a letter and calling on the government to make the vaccines, which are approved for 5 to 11-year-olds, available to kids who are within 3 months of their 5th birthday, so say 4 years old and 9 months. Is that something that is being considered as right now, giving them the opportunity to get this dose a little earlier?
At the moment, that's not something we're considering doing. Health Canada approves vaccine for a certain age group. NACI makes recommendations for certain age groups based on approvals, and so we try to stick to that as much as we possibly can. It's guided us well up to this point. The research that's being done with these the trials that are being done with these vaccines for under 5 are being done with a different dosing as well. So we have to remember that and take that into consideration. So at the moment, no, we're not making those. We're not making that change.
Thanks. As well, I'm wondering, the Omicron wave happened at a time when some people were not yet eligible for their booster. So it's possible that there are people out there that were recently infected and recovered and now have some natural immunity. Should those people wait to get their booster, and if so, how long should they wait?
So the evidence is really evolving around this, and there is some that says there's some evidence that says you can wait to get the best boost from the booster post-infection. However, we do know that it's safe to get the booster after you've had an infection. Once your infection has, your symptoms have resolved and you don't have a fever, you're not considered infectious, then it is still okay for you to get the vaccine at that point. The booster will improve your response overall, even if you have had a natural infection. So it is still beneficial to get the booster after you've had a natural infection.
I will now go back through each reporter to see if you have one final question. Ben Cleary with NTV, do you have a final question?
Yes, I do. Thank you. And it's for Dr. Fitzgerald. And I know it's hard because March 14th is a little ways away, but what is public health kind of projecting to see when all those restrictions are loosened and taken away? Could there be a spike in cases, or what are you projecting there?
Yeah, so anytime we loosen restrictions, and people are allowed to do more, there's going to be more interactions, more contacts that you have. So there is that opportunity for the virus to spread. So anytime we release restrictions, I think we expect to see a little bump up in the number of cases that are circulating and that we see on testing. So we wouldn't be surprised if we saw that. And of course, with a bump in cases, a little while later comes a bump in hospitalization. So we wouldn't, that wouldn't be unexpected if that were to happen. But, we are at a point where we have to consider that the measures that are in place, are also having consequences, and we need to make sure that we're balancing those consequences with the consequences of COVID and our hospital capacity. So those are all the things we have to think about. And so, yeah, I think we will see a little bump in cases, but we are doing this in a way that we anticipate will allow us to be able to absorb those bumps and be able to move forward as smoothly as possible.
Thank you.
Peter Cowan with the CBC. Do you have a final question today?
I do, and that question is about testing and reporting of case numbers. At what point do you think we'll be at the point where we no longer need to test sort of general members of the public if they've got symptoms, for example, and it'll be more restricted to a clinical setting? And at what point do you think the province will no longer be then reporting some of these daily metrics?
So now I might not be the best one to answer that question because I'm a bit biased, but I think, certainly we're looking at how we will approach testing going forward and what will be our testing strategy as we move through, through the rest of this wave and then into the fall, because we do anticipate, of course, that we may see some cases in the fall as well, and that may be combined with influenza. So, we have to think about that and how we will be testing. So we haven't come down on a definitive plan at this point. Certainly, I think we will have to move away from this, from daily reporting of cases and look at it more in to report in a way that we do with influenza, where we update on a weekly basis throughout the influenza season. And I think that's certainly the way we will have to go with things moving forward.
Richard Duggan with VOCM. Do you have a final question?
Yes, Dr. Fitzgerald, after March 14th, as was mentioned, some people may still want to mask up, some businesses may still want to have some requirements in place for people to come in, etc. Some people may worry about being ostracized for still wanting to wear a mask or for still having some of these requirements in place. What would you say to people who are having those worries, or to if those situations do arise where some people are face that for continuing to mask up and that sort of thing?
Masks aren't gone on March 14th. We strongly recommend it.
Yeah, so we're still strongly recommending them. And I think, we saw when we removed masks back last summer, people continued to wear masks for quite some time afterwards. And, there was still really good compliance with it. So I think people have sort of changed the way they think about masking right now. And what we thought initially, people thought, oh, it's over, you're overdoing it or whatever. It's kind of changed now, and people are accepting that, masks actually do a good job at helping to reduce spread of not just COVID, but other respiratory viruses as well. So we have to remember that. There may be a role for masking at reducing spread of other respiratory viruses, such as influenza during their seasons, in facilities, for example. So we need to think about that moving forward. So I don't think masks will ever be completely gone. I think we'll be thinking about them in a different way than we have before. And I think that anybody who wants to continue to wear a mask, obviously we have to be accepting of that. I mean, it's no different than, if somebody perceives a risk and they want to take precautions to reduce their risk, I don't see why it doesn't affect you. It doesn't have anything to do with you. Why would you take exception to that? And for businesses who want to keep masking in place, they may have some very good reasons for that. They may have employees who have health concerns. There may be, they may have a greater than average older population that they want to protect, so we have to respect those wishes. And, it's not the end of the world. It's just a bit of fabric on your face.
Andrew Waterman with The Telegram. Do you have a final question?
Yes. I'm wondering, actually, with regard to masks, this would be for Dr. Fitzgerald, I imagine. In terms of school, I know that you're saying it's still strongly recommended. But for kids in K to 12, will there still be a mandate to have that in the classroom?
So I think we have yet to, we got to have some conversations, obviously, with Department of Education and the school districts to talk about masking and what they want to do moving forward. But again, I would encourage that any parent or children who feel like they want to wear masks, that they should be, that should be an accepted thing that they can do, and that, masking will still be strongly encouraged. We know that it does reduce the risk to a fair degree reduce that risk of transmission. So, we don't have I don't have a definitive answer for you with regard to schools at this point, though.
Thank you, everyone. Premier, would you like to make any final comments today?
Sure. Thank you all for joining us. It is a good step forward in the fight against COVID-19, but it's not a declaration of the end of COVID-19. In fact, if one thing's been proven throughout this, the only thing certain is the uncertainty. And I think as a panel and as Dr. Fitzgerald and her team have shown a willingness to be dynamic and flexible to the changing situation, the evolving evidence, the evolving science that unfortunately has been this pandemic. That said, this is a good step forward for the people of Newfoundland and Labrador, and is quite rewarding for all the hard work and sacrifices that you have all put in. And I wanted to end on this by thanking a friend of mine in Sheshatshiu, Mary Pia, who sent Dr. Fitzgerald and I some beautiful hand-knit slippers that keep our feet warm. So thanks for helping with the vaccine, and thanks for keeping our feet warm.
Yes, thank you, Mary.
Thank you. Thank you, everyone, for joining us today. Please stay safe and enjoy the rest of your day.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
If you have a comment about this program, we'd love to hear it. Email or call us, or send us your feedback through social media.
Hi, I'm Carl Wells, getting ready to record another edition of Carl Wells Point to Point. It's a program where I chat with members of our community, and they talk candidly about their lives and careers, from their earliest dreams to their greatest triumphs. I think you'll find it informative and entertaining. Please join us for Carl Wells Point to Point, right here on Rogers TV.
Hey everybody, how are you doing? It's your boy DC, Thursday night host of Rogers Out of the Fog.
Right, you kind of got to make your own fun.
Yeah.
Which was a transition for me, going into the morning show here.
Proud. Keep doing the amazing work, will you?
They're learning about how to hire people.
20 years of local matter, so join me every Thursday night and see what's going on in the fog.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
Active and knew something wasn't quite right. She had, despite exercise, she was gaining weight and found that her stomach was feeling very hard. So she sought medical advice and went to her local physician, who was a male, and basically told on repeated occasions that it was menopause. So after about 6 months, she decided she would get a second opinion, and then went into one of the main centers in central Newfoundland and met up with a